There's a lot of lymph nodes along the inner thigh and up into the inguinal triangle. So to get this drained, you place your hand along there and you find these nodes, and you just want to work into that area. And again, it's a skin stretching. You pull it and then you ride back on the skin. And take a broad hand and push it toward those nodes, always in the direction of the flow. Our lymph vessels are so vast in our body that basically if we didn't have anything but lymph vessels, we would be basically recognizable, because there's so many of them. So it's important to remember that they need to be stretched in order to be able to have their little peristaltic action to push the fluid through. And if you go into the system too hard, too deeply, too quickly, or do deep work with it, you're not going to really affect the lymph system, because the vessels just don't respond to that kind of work. So although there might be a little bit of stimulation with the lymph system during regular massage therapy, it really doesn't move the lymph unless it's addressed along the lymphatic structures and the way that the lymph fluid moves. There's nodes behind the knee, popliteal nodes. Those are important to make sure are open, especially if there's any swelling in the lower extremity. And then we just continue with the skin stretching. And around the ankle bone, into the foot. And again, this is just the basic work. We can get into the joints. When you are going to drain a joint, I'll show you how to drain the knee after we get this rinsed back up. Now when you're draining knees or joints, you want to stabilize the more proximal end of the joint of where it's coming together, and you just rotate the bottom part back and forth. It's a little rotative move. Just enough to get that lymph system activated in there and get those fluid in there moving in those little vessels. And then just continue to rinse up. And I could feel a releasing of that knee. It did have a little bit of fluid around it, not anything serious, but enough that is good to keep it moving. And then back into the inguinal area. And then rinsing up through the deeper structure nodes, and then opening up at the clavicle. And then map. And the fluid is all good current. Then you do the same thing on the other leg. Now here there's some fullness in these nodes in the inguinal area. It's on the right side, it's on the liver side again, so the congestion that was happening in the liver affects the entire side of the body. The body all ties together. Now you don't want to do lymphatic work if there's a lot of deep bruising Although there is a technique that can be used for bruising, you have to know what you're going to be doing with that, because that can be a dangerous situation. So if you see bruises, particularly large ones, just stay away from it. Any kind of skin irritations or anything like that, it's best to stay away from as well. Just work around it, let the fluids that are close to it carry the things out, but don't get on top of the wounds or anything like that until you're knowing exactly what's going on. I'm going to be doing the broader move here. Hope you can see that okay. And then down to the knees. Nose behind the knee. So it's that little push, stretch, and riding it back. When the fluids start to move, it's like this movement of this silent water, and it's very, very relaxing. I've helped a lot of people feel a lot better with lymphatic drainage, with all sorts of different cases. From stomachs being stapled and the illness that persists after that surgery. Getting those fluids moved in that type of a situation just really helped the person to feel better, even look different when she left. One in particular I'm thinking of, but I've worked on more than one. It's also good for post-op if there's been mastectomies or just abdominal surgeries or gallbladder removals or anything like that. It's helpful, and it also helps the healing process. I've seen some pretty serious medical procedures done and rather quickly recoveries on people who have come in for lymphatic work. I also work a lot of children with congestion in their sinuses as well as their ears. Many children just need their ears drained lymphatically. They don't need to have those tubes put in them. And unfortunately, we don't have a medical system that does anything else. They just stick tubes in. So very few of my clients even mention to their doctors what they're doing, because they're finding out that this takes care of a lot of ear infections, and their experiences have been with these young children that they've been on antibiotics for many series and they still are sick. And when they bring their children in, if they're rattling in their lungs or their breathing is very labored because of a lot of congestion in their noses, we actually hear a difference in the way that their breath sounds, the way that they're breathing at the end of the session. So it's a very, very important modality. If any of you are interested in learning it, there's different places that you can. I personally teach people who are interested in individually getting this. I will not teach it for CEUs. I don't want people to come in just to satisfy the state requirements. It's way too valuable of a modality to just have people there biding time so they can renew their license. So I work only with people who are genuinely concerned about having this modality in their own hands to be able to help people. It's just got too much to it to brush out real quickly. This little thing that I'm doing here is just a brushing of the fluids in the direction that they are to go. Now we're draining spinal leg. Okay, so this is just a little demonstration of an explanation of lymphatic drainage, and I would encourage all of you to find somebody in your area to experience this. I would also suggest that you be sure that they're trained either from the Vater or the Chikli method. Anything else out there, I don't know what it is, and I don't know if that would be a good thing, because I have seen people who have experienced some pretty rough work that I don't think is lymphatics. So just be careful, know what you're up to, know what you're doing, ask questions, and of course I'm always available either by email or by phone. This is Athena Jezik,